Integrating population health and environmental issues, otherwise called the PHE approach, is the solution to neutralize the complex problem now threatening the integrity of Lake Victoria, the golden treasure shared amongst Uganda, Kenya, and Tanzania. Recent studies show that the Lake Victoria Basin is experiencing enormous pressure arising from the uncontrolled activities of the very fast-growing population, estimated at over 100 persons per square kilometer, one of the densest and poorest rural populations in the world. Previous interventions have been piecemeal and could hardly resolve this highly intricate social, economic, political, and technical problem. The good news is that the PHE approach now offers the solution, thanks to the health of the people in the Lake Victoria Basin Project, otherwise called HOPE LVB, that introduced the approach 3 years ago on a pilot scale. The PHE approach is holistic and promotes the need for improved access to family planning and reproductive health services for the families within the Lake Victoria Basin, while at the same time using cost-effective, affordable, and sustainable technologies to promote the conservation of the environment and the natural resources on which they depend now and for the future. HOPE LVB is a regional project to match this cross-border nature of the problem on Lake Victoria. In Uganda, it is implemented by Pathfinder International Uganda and Ecological Christian Organization ECO in Busi and Jaguza Islands in Wakiso and Mayuge districts respectively. While in Kenya, it is implemented by Pathfinder Kenya and Osianala in Gwasi and Karatwara divisions, both in Homa Bay County. It is funded by USAID, John D. and Catherine T. MacArthur Foundation, and the David and Lucy Packard Foundation. Let us explore how each of these elements feeds into one another and how together they can save Lake Victoria and its basin. Population issues. The project tackled the challenge using the existing structures such as beach management units, local councils, and families. Using model households as focal learning centers, the project illustrates to the members that overpopulation is among the leading factors responsible for depleting the fish stock, their very source of employment, food, and incomes. Now aware of the root cause, the communities have devised workable interventions resolving family planning and sexual reproductive health issues. At the implementation level, the women were encouraged to form groups and trained to start income-generating activities such as rearing goats and nurturing tree seedlings for sale as one of the ways to make them less dependent on their spouses. With a fairly leveled ground, the women are now able to make meaningful decisions regarding their reproductive health, but most importantly, to discuss family planning issues and the well-being of their entire families with their husbands. No doubt, sooner than later, the people will by themselves keep the population in check. Health issues. For maximum results, the project trained village health teams, amongst them men, to reach out to the communities within their localities using the door-to-door approach to share with them the benefits of family planning. This not only simplified the hurdle of walking long distances to health centers, even over issues that would be solved locally, but also encouraged more men to spread the gospel of family planning services. And today, they spearheaded the campaign to ensure that their families live a healthy life. They no longer see family planning and sexual reproductive care services as women issues, but rather as a family matter. They are usually at the forefront to encourage and support their spouses to go to the health facilities to immunize the children and to get any other health services that will increase on the quality of the health of all the family members. In fact, they even use their patrol boats to deliver medical supplies and evacuate patients from the islands to the mainland in emergency situations. So the increase in the number of deliveries in health facilities from an average of 3 mothers before the project to now over 30 per month is not accidental. On the public health front, the communities within the project area now have clean bathrooms and latrine stances with a good shelter and covers. They also harvest rainwater and store it in clean and safe containers for domestic use even during the periods of drought. Many people are also increasingly becoming food secure despite their small landholdings, thanks for the high-yielding crops alongside the good agronomic practices that the Hope LVB project shared with the households. Environmental issues. The communities have also understood the complex interrelationships between the health of their families and the natural environment. They, for example, know that fish have a life cycle, like human beings, and that for the fish to benefit them maximally, they must let it grow and pick only the mature ones as the cycle to breed more continues. To achieve this goal, they are now protecting the breeding zones and continually scout the waters to block those tapping the young fish. The communities have also started the agroforestry campaign, particularly with agroforestry shrubs and fruit trees. Besides offering a major alternative source of income as the communities wait for the fish to grow, the trees will also offer environmental as well as nutritional benefits to the communities within the basin. So, the family members and others like them now know the need to plan for their families and therefore do not see the need to go back to the lake because they have a strong livelihood base through farming and selling the different varieties of seedlings. Several others are also venturing into the apiary projects. This means that more trees will be planted as well as protecting the few that survived the wanton deforestation to maximize the returns from this virgin enterprise. In the same direction, Hope LVB introduced energy-saving stoves to reduce the pressure off the forests. The stoves use very little charcoal and present a smokeless cooking environment for the children and the mothers, saving them from inhaling the smoke and the long distances in search of firewood for cooking. Today, there are over 20,000 energy-saving stoves within the project area. People who excel to speak publicly about the PHE are identified by the communities themselves to lead the community-level initiative in promoting the PHE activities. They're called champions. The Hope LVB project has since given them a more in-depth training about PHE processes and given them training materials to promote the integrated approach to local government and other development projects. Banking on this success, the staff and the partners of the project have engaged key district, national, and regional health and environment officials in Kenya and Uganda to 1. Increase stakeholders' understanding of the interconnectedness of PHE issues and the benefits of the PHE approach. 2. Increase the capacity of key stakeholders to communicate about the PHE approach. 3. Provide platforms for policy dialogue to influence regional and national stakeholders to integrate the PHE activities into their programs. And 4. Raise the profile of the Hope LVB project. In Kenya, Homa Bay County, the PHE initiative has already been integrated within the different levels and structures of governance within the county. They now have the PHE steering committee at the county, and the county chief of staff has created an autonomous department to coordinate PHE activities in the county. The other local governments within the different countries benefiting from the Lake Victoria Basin should pick a leaf from this example. The Lake Victoria Basin Commission, besides working with the PHE champions, is moving towards institutionalizing the PHE approach into national and regional policies and to develop a regional PHE framework for cooperation in the Lake Victoria Basin. With funding from the USAID East Africa Regional Office, the Lake Victoria Basin Commission is coordinating the national PHE working groups and soliciting proposals for studying the population, health, and environmental issues in the region. Hope LVB will continue to work with the Lake Victoria Basin Commission to influence other regional bodies in Burundi, Kenya, Rwanda, and Tanzania to integrate the PHE initiatives in the formal governance structures from the lowest unit at the village up to the national level. A well-informed citizenry about the PHE approach can only do what is within their powers. unless the approach is given the full support by the different level, local, national, and regional governments by integrating it in their various development programs. No level of policing will ever change the tide in the basin, as the integrated PHE approach has demonstrated. If all of us embrace the PHE approach, Lake Victoria, its basin, and the over 40 million people living within the riparian region will once again enjoy the benefits therein to the full, much sooner than later, and at a very cheap cost. And why not?